Welcome. How's everybody been doing? This is December. Uh, I just wanted to thank everybody for the love I've been getting. I got over 300 subscribers, and I started this back in January. So um, I do want to thank everybody who has subscribed, liked, shared a comment. Um, I do feel very special. I didn't know we'd get such a great following, about being a nurse home administrator. Usually, it's one of the boringest things you can think of is making videos about being a nursing home administrator and following along with some of the things that are going on in the industry. And this year has been a very busy year. First of all, because of the COVID crisis that's been going on. So, much love to all the essential workers out there. It's been very difficult and hard, I know, for everyone. And also, let's remember the ones that we have lost to this COVID-19, also to this horrible virus that's going out. Um, Last time I actually did a live video. I was driving back and forth on a couple properties that I was about to obtain. Um, Needless to say, I did not go through with that purchase, um, and because of the whenever you go through with a deal or looking at a deal, you have to sign some no disclosure form. So I can't get into that. But I did not go through with the nursing homes that I was trying to get. But since then, I have been doing some interim work. I'm with a group of partners for trying to start a home health hospice with a PSA, that's personal assistance. So I'm with the group now, but the process take about a year to get certified through CHAP. So I've been doing a lot of interim work. So this that leads to this video. The video is going to be jobs that you can have as a nursing home administrator without working at a nursing home. So we're going to go through several jobs that you can do with your nursing home administrator's license. So one of them, you can always be an administrator of a home health or a hospice company. A lot of those companies do prefer that you be a nurse, but just like in the nursing home, there's somebody that needs to be financially uh, obligated to make sure that financially everything is on track. So yeah, a good 80%, I would say, of home health and hospices do hire RN to be their administrator. But nurse home administrators actually like what I did now. Back in 2006 or 7, I started my own home health, and I didn't have to hire an administrator because your license do work as a nursing home administrator. But you do have to have RNs on staff. So some companies, they, I guess, hire the RN to be their nursing home administrator, which they can do. But there's pros and cons to that. One, you don't have to pay a nursing home administrator to be your administrator, since you have a RN as your administrator. But financially, we do what we do because we're good at it. And if there's ways to make sure you fall within a profit and loss where you're always in the green, then that's when your expertise come in as a nurse home administrator, especially if you're seasoned. Another thing is dialysis companies. Look up your dialysis. Those have to have administrators also. So you can definitely apply for any dialysis centers because they do need an administrator, someone over their staff. Same thing about LTACs. LTACs, usually when I used to go out and market and talk with the administrator of the LTAC, it's a semi hospital, semi, nursing home. It's in between long-term acute care. So they're going by the wayside nowadays, but there are a lot out there that you can go and be an administrator at an LTAC. That's just one way or another route to go. Let's see. LTACs, home health, hospices, assisted living. If you ever get tired of the grind of being in a nursing home, you definitely can go back to assisted living or start out at assisted living. You kind of got your grandfathered in if you have your nursing home administrator's license. You can actually, if you don't have any type of license, you can go and take a 40-hour course and become an assisted living manager, director. It's called differently in different states, but you definitely can always go and do that. Now, the big thing is a lot of people like, well, what about hospitals? Yeah, hospitals have several administrators. And if you are willing to start early in your career, I was just having a conversation with another administrator about that. Definitely try to get in as soon as earlier as possible, because you're not going to make a lot of money at the beginning, but at the end it can be well worth it. I was in a small town as a nurse home administrator and became real good friends with the hospital administrator, and he was making, in a small town with 3,000 people in the whole town, he was making 140, 150. And I'm like, wow, I'm in the wrong, industry or in the wrong position. But yeah, you can make a lot of money. So if you think of some of the major hospitals, but you're not just going to walk in the front door and say, I'm going to be your nurse home administrator. There's clubs and organizations that you really need to become a part of. One of my people that I precepted, she was actually looking to go that route, and so she had a little bit more information than I do. Maybe in the future we can. I would plan on having a lot of guests on here, people that I know in the industry. I really need to make 1,000 views so we can do a lot more with this YouTube channel. I would love to have like live streams where people can be on here at the same time and ask questions, and I can answer them. In the future, I do plan on being a little bit more active. Like right now, I'm on vacation. Like I said, right now, interim work is like booming. A lot of the people who are in the that were elderly administrators, they have completely just got out the industry and just said, hey, my health is way more important than any form of money that you can give me. That's why when I was reading some of the chat on the chat, when people was like they couldn't find jobs, I don't know how. I'm beating them off with a door, with a broom. As soon as you open your email, there's a lot of people like, can you come do some interim work for me for this much, or for a little bit. You go on Indeed. The company that I'm doing a lot of interim work for, they're looking for permanent administrators, and I'm like, I'm not gonna, I'm not looking to be a permanent administrator right now. Very focused on trying to ensure that we get everything ready for our hospice company that we're going to start. So, but some of the benefits of interim, you save a lot of money. The way the interim works, I was going to make a separate video, but I'm going to just give you the gist. Let's just say whatever your salary is, if you go out of town, they're going to pay for your mileage, they're going to pay for your food, they're going to pay for your hotel. Definitely, you could save some checks if you're, single, or, know how to manage your money. So basically, after your first 2 weeks, when you get your first check, and then you get your reimbursement check, you can just definitely just live off your reimbursement check, just every week if they reimburse like that. Company I was working for, they work like once a week. I get a check for my reimbursement, so I wasn't spending any extra money. Um, Saving a lot of utilities because I'm gone Monday through Friday. So your electric bill is like really, you might have a $40-50 electric bill for the month. If you're doing a lot of interim work, you can just put $100, $200 one time, and it'll take care of 3 or 4 months. You don't have to worry about buying food because you're eating out. Different companies give you different stipends. So you might get a $30 to $35 stipend a day to eat them. So, and you're going to get that, you pay, and then at the end of the week, maybe that following week after you turn everything in, you're going to get that money right back. So, it's an easy way to catch up on your bills. Make sure that, you just basically paying, your necessity bills, your mortgage, or if you got an apartment, your car note, but like electricity, water bills, you'll definitely see a decrease per month if you just do a lot of interim work. Good thing about interim work, you see a lot of places you never even thought of, especially, within the state. I choose to do in-state, but there are a lot of companies, Healthcare 360, I believe is their name, and there's some other ones that if you want to go out of state and you're able to get your license out of state, you definitely can go and travel. It was a couple of years ago I was looking at doing that, and they needed help in Maryland, they needed help in the Washington, D.C. area, Florida, all over, Idaho. So you definitely, if you want to do a lot of traveling, you definitely look at those companies that you can go in and they'll send you somewhere in another state. But one of the things they're going to ask you is, do you have a dual compact license for being a nursing home administrator? Some of them would help you, some of them won't. You definitely have to, you just have to go on to whatever state you're looking for, nursing home administrator site, and see what their qualifications are for transfer. I know for a fact that Indiana, if I ever wanted to move back home to Indiana, I just have to pay a fee. I think like somewhere around $75. Some of them, they do give you another test. So you just have to check and see which state you're looking to go to, and see what their rules are for transferring your license. But some are simple. Some of them, they want you to do a test. Some give you a temporary license for a little while until you get everything up in the float for their transfer. But I do want to again thank everyone. Hope y'all been enjoying the little videos I've been making. I've been doing those on the road when I've been doing a lot of traveling. It was real easy and just to put together, and then have the voiceovers. So I know it's been, like I said, a long time since you see me face to face. But if you leave any questions below, I would definitely try to answer them in the video. And like I said, I'm off for the next 2 or 3 weeks into January. Just wanted to get some things done around the house, and it just kind of hit me that it's almost been a year since I started this YouTube channel. I think I did my first video sometime in January, maybe January the 1st, I think. That's when I was running back and forth out of town with the facilities I was looking at, and taking a good look at those. But I wish it would have worked out with those facilities, but financially wasn't going to work. Like I said, I can't get into it because of the non-disclosure clause, but I think I saved myself a lot of headache, a lot of money, and it just so happened at the same time my dad's health went down, so I had to go to Indiana for at least 30 days. I was there. I think it was there February and part of March, and that's when the COVID started shutting down the businesses. So it was very, very, everything just kind of happened at once. So yeah, but as soon as COVID hit, I started getting a lot of calls when you come do some interim work, you know, and I'm not even talking about in town. This is like, you know, Houston area. I live in the Dallas area, so in the Houston area, the Denton area, you know, it's all over. You know, some was in the DFW area, but a lot was out of town. So, you know, if you like to travel, it's a great opportunity. You know, while you're there, you know, you can see different cities. You know, but it's some people don't like to travel. Um, Before I wrap up, I'm just trying to think of anything else that I need to say. Yeah, I'm looking at my old over there where we did the spin downs. Uh, you know, I try to do everything in a good lighting area. This is actually my formal dining room area, you know, with the long table. So I'm actually just up against the wall. You could probably see one of my boards that goes into my table over here, but I do want to help everybody. Being a nursing home administrator, you have your rewards and you have your failures. You have your good times, you have your bad times. I do plan on writing a book about being a nursing home administrator. I always try to keep these videos very positive, but if you're in the industry, there's a lot of negatives, and I wanted to put that in a book. I just don't want to just be like rah 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 bad things, because I do want to help people who do want to be a nursing home administrator. But it's a lot of hard work. There's a lot of people who are in the industry less than 6 months or a month. First job, they gone after that. It's stressful. You know, sometimes a lot of times you just can't get a good night's sleep, especially if you got one of those homes that are, you know, always in trouble or you know, needs a lot of TLC. So, but you know, you have your good days, you know, where you see people smile, you see people, you know, even your staff, they're happy, y'all having fun, you know, y'all vibing off each other, you know, taking care of your residents are happy, you know, they have their medications, they have their good food, they have their good care, and then you just sit back and you just feel it. You just feel the glow of the whole nursing home. And that's a good feeling, you know, and, you know, it can go away 2 days later. So, or 1 day later, you can be like, oh, what happened to that good day? But we're not going to dwell on the bad things. We're going to dwell on the good things. And, you know, you'll have more good days than bad days if you just, you know, keep listening to what I say and put it to good use. You know, being at one place for 8 years is kind of unheard of. And that's one of my goals I did. And one of the goals that I succeeded in is, I think somebody even, when I mentioned that in one video, you know, 6 months is kind of the norm. And not that everybody who stopped working only made it 6 months, but average. So that means if you get somebody who walked out on their first day or their first month, compared to somebody get walked out after a year or just quit after a year. So the average is 6 months. And it happens. I have seen or had competition, you know, go over there and meet an administrator, then go over there next week, oh, well, they already been terminated. You know, wow. You know, so when I was at one place for 8 years, I think I went through what I would consider my competition, 3 to 4 administrators. So it's all about finding that right company and making sure that, you know, that company has your best interest. And by you having them having your best interest, that means your interests are solely on the residents, your staff, because there's some good ones and there's some bad ones, and I'm not gonna, you know, say anything bad about any company, even though there are some bad companies and there are some good companies. And even when I have one of my people that I precepted, she did agree that she wouldn't mind being on camera. Well, not being on camera, but helping me with my YouTube. And I think she'll probably tell you more that that I would probably even want to tell you, but it's out there. It's information that you should know, and hopefully that you can use that for your benefit. So again, thank you. Let's make sure to 2021. I got over 300 subscribers. I will hope that I could double that in 2021, and the sooner we get to 1,000, the more fun we can have with this YouTube. And we can definitely, I do plan on opening up I think it's called a Pantheon account. So I do have one, but it's on my phone, and I guess I have to work out the kinks. So I am definitely trying to make this bigger and help out anybody who want to be helped out, even if you are looking to be an administrator or you are an administrator, because it's always good to have someone that you can ask questions and bounce off of. All right. And nobody had more adventures of being an administrator than I have. I bet you. All right. So again, thank you. And next video, we'll see what we're going to talk about. And if you got any suggestions, leave it in the comment. Like I said, got a lot of time off in the next couple of weeks. So let's make some videos. And thank you for tuning in to the Nursing Home Administrator. Like, subscribe, hit the button so you can be the first one when new content come out. And please share. There's a lot of people that are looking for content like this, and I guess happen to follow up on it. I look at the algorithms, and as more people just happen to just pop up and say they found it, other than someone sharing it or some return people coming back. So the more people that hit the like, the more the algorithms will let people know that there's this type of content out there. So you have a great day. Hope I got me a boom mic. Well, I don't know if it's a boom mic, but hopefully it sounds pretty good. Let's see. That's what I'm trying to do a lot. Let's see if I can turn it a little bit. See right there. So I'm getting kind of serious with this YouTube. Like you said, all those things that the chalkboard and all those types of graphics, it costs money. Boom, the mic and everything. Actually working on a Surface Book Pro. So used for YouTube and other endeavors that I'm working on. But yeah, I'm trying to be a little bit more professional with it. You have any suggestions or anything that you would like to talk to me about, please do so. The Nursing Home Administrator at gmail.com. You can always reach me. Well, until next time, have a great day.